Brenda Nettles, and I'm acute care oncology certified nurse practitioner at Johns Hopkins Hospital, assistant professor at Johns Hopkins University. And I have had the privilege of presenting at ONS many times, but this particular conference I focused on my work with survivorship and looking at long-term survivorship needs of our patients. And this aligns very well with what I do in my current clinical practice in survivorship cancer care. So I looked at, in particular, the need of people that have had long-term survivorship. So an estimated 18.1 million people have actually entered survivorship for their cancer diagnosis. So my interest in this topic aligns with what I do for my clinical practice as an acute care NP at Johns Hopkins Surgical Oncology. So we look at the needs of our patients as they transition from active cancer treatment to ongoing survivorship. In my practice, I see people for ongoing follow-up visits with CT scans for the surveillance of their disease. But with that, there's also a need to look at them as a whole person and individual. So we move beyond at some point, getting past the need for monitoring for recurrence of the cancer as part of the visit. But the bigger part of it is really looking at them as what they want to do to maximize their quality of life after having undergone these very aggressive surgical procedures and chemotherapy regimens. So by doing that, we talk to them about what their values are, what things are important to them as an individual, because we know this is someone's mother, their father, their sister, their daughter, their partner. And with that, they have a sense of self that kind of gets eroded away by cancer diagnosis. And so how do we help to restore that? And that looks at the things they want to do as far as short-term goals, long-term goals. What are their unmet supportive care needs that we can address as part of that? A lot of it, again, is first looking at basic needs being met. So they may have problems initially with tolerating dietary intake, having normal control bowel habits, pain control, just general fatigue after undergoing these very aggressive cancer procedures. And it takes time. We're talking about 3 months, 6 months before things kind of seem like they're actually pretty normal again for them. But then beyond that, and looking at their diagnosis and watching for their surveillance as far as recurrence of the cancer, we want to make sure that we are having them tied into the right resources, social workers, to get them involved with things to help them as far as things at home. If they're going back to work after extended periods of time, how do we optimize and be able to tolerate going back into a workforce every day? And the other part of it is the financial toxicities of cancer care itself. It's very expensive to undergo cancer treatment. And unfortunately, we have people that are very young now that have cancer diagnoses that are just entering the workforce, and people that are very old and they may have a need to think about retirement differently because now they're having to utilize resources from retirement to pay for their cancer treatment. And that shouldn't be a matter of having to choose one or the other. So however we can support them with that, that's very important to us as a clinical practice as well. So the bigger part of it is that everyone's cancer experience is different. And so the people that have access to health insurance and have access to supportive networks to support them as they go through active treatment, they tend to have better outcomes. But for those people that don't have access to, if they're underinsured or uninsured and have to navigate systems a much different way to get the basic care done for their cancer treatment, they have poorer outcomes, unfortunately. So we talk about disparities and inequities in cancer care. That must be an ongoing discussion because our patients should have quality care no matter what their means to pay. The other part of it, though, is also looking at, again, how the needs of the older versus younger patient may vary. And so with that, we need to think about how we engage them as far as support groups and resources to prepare them for the different challenges they'll face throughout their cancer journey as well. They don't know what to anticipate. So you really have to be that guide for them to actually explain the things as they're happening to them, but also kind of give them a long-term forecast of what they can anticipate. And that helps them to actually be able to work with their family members and their friends as an expanded support network to actually enhance that lived experience as they're going through active cancer treatment and ongoing afterwards. So we want to make sure that people are just aware of the things that are available in their communities and their American Cancer Society and other groups that are actually able to partner with them as well to help give them better quality of life as they go through active treatment and thereafter. We do take care of patients in the holistic approach that we do talk about their cancer diagnosis, but that's not the end all be all. The visit, again, as I said before, we want to make sure they know we care about them as a person as well. And that means asking questions about the things they value. Where are they going to spend their time with this year as far as family vacations and holidays, and what things may be troublesome for them not be able to do those kind of things as part of their immediate short-term goals and long-term goals. And that's how you begin to identify and partner with the patient in regards to helping them prioritize what best things we can do to help them reach those desired health outcome goals, but also personal goals. for ongoing quality of life. I think a bigger part of it is that it's become more mainstay. A lot of times these programs are secondary to the preventive measures that we take for people that have cancer and also people who are in active treatment. So there needs to be more time dedicated to being able to support these resources for our patients because they will continue to live longer, we hope, with more advances in cancer therapy. And it should not just be length of time after cancer diagnosis, but also should be quality of life after cancer diagnosis. That's very important as well.